Hi, YouTube community. Again, my name is Rich Rosenblum, and I'm here to talk to you about nursing school. I just finished my second semester at Umass Boston, and it has been a whirlwind. So, the point of this video is to tell you about my experience, about not about how I got into nursing school, those are in previous videos, but about the course load and my struggle going through it and my goals going into our third semester. So, a quick overview. I used to be in the fitness industry. I used to be a strength and conditioning coach. I used to be a civilian strength and conditioning coach for the U.S. Army. Pandemic hit. No one needs. I an overeducated fitness manager at that point. Got laid off. Perfect time to go to nursing school. So I started in September 2020, and now it's May 2021, and I'm still alive. So, a couple things about UMass Boston, why I chose that university. One, I already had a relationship with them because I was the fitness manager there for about 2 years. So I was already living in the area. That was convenient. Also, during the pandemic, they waived the T's. So that was like a no-brainer. Like, why study for another entrance exam when I can just apply, make sure my prerequisites are on point? And three, I was able to transfer in most of my undergraduate and master's courses. I have a master's in exercise science and only had to take 3 portage courses. Yes, the accept portage, and I was able to transfer all that in. So I only had to take 3 intensive portage courses, apply for UMass Boston, and I got in. So, a little bit about my struggle, because it's more unique than your traditional nursing student. I developed bilateral carpal tunnel prior to going to nursing school, and I got bilateral surgery. I got 2 mini open carpal tunnel releases before school. 99% of the time, you get this done, you're my age, you're young, you're fit, you're healthy, you should be good to go after like 2 weeks of recovery. You should be back to doing what you need to do. Not this guy. I got something called pillar pain. So the thenar eminence area here has been lit up. When I try to write, it's almost worse than carpal tunnel because I couldn't pick up things. I couldn't type anymore. I couldn't write anymore. So I went through these last 2 semesters basically disabled. Pain is bad. Every day I wake up, it's like a struggle. Trying to type is like doing a crazy math problem. I bought all kinds of different tools and modalities, all kinds of different therapies. It has been a struggle bus, but I got through it with the support of the university and just discipline. So, putting that aside, my path is going to be different than your traditional nursing student that can just knock it out and not have to deal with impairments. Okay, so let's talk about the first semester of nursing school. The courses that you take, I have them listed here. They're going to be, your hardest class is going to be Nursing 271, Principles of Pathophysiology and Pharmacology. Yes, they put 2 classes into one, pharmacology and pathophysiology. That class is no joke. You got to spend the most of your time studying for that class. It's 3 credits. And if you don't already have a strong anatomy and physiology background, you better step it up because it's a tough class. Other responsibilities aside from the exams, and I'll tell you right now what the breakdown is. There are 3 exams. They are worth 15% each, usually about 50 questions. There's a final exam, which is 20%. There is the HESI fundamentals exam, which is 5%. Now, the HESIs can be entrance exams into nursing, or they could be like exit exams into nursing. Some universities use them as, in addition to your finals, to gauge your ability to understand basic concepts of nursing. And passing the HESI exams is a good indicator if you're going to pass the NCLEX, if you're going for the Bachelors in Nursing. So the HESI exam is worth 5%. Assignments, which are case studies, more multiple choice questions, called EAQ. And we actually did this Pinterest board about skin cancer. Those are all worth 30%. And then there's a HESI practice test that's worth 5%. Again, 271, no joke. You could spend a lot of your time studying for that. What's the best way to study for it? I'm the type of person that I need to read something over and over again. I'm sure there are more efficient ways to do that, but that works for me. I didn't really use note cards. I would review the material through the PowerPoint lecture. And a big shout out to notetakingexpress.com. Part of the issue with being like slightly disabled with the bilateral carpal tunnel issue is that you can register through the Ross Center at Umass Boston, and that can provide you some accommodations. So one accommodation that I was eligible for was notetakingexpress.com, which will transcribe lectures. And that was essential for me to get through my first 2 semesters. Sometimes these lectures are 2 hours long, and there's no notes. Sometimes there are notes, but often you need to transcribe and take notes. It's really difficult to do that if you can't type. If you just have all this pain from the pillar pain or whatever impairment you have, it would have been crazy. So I was able to send these lectures to Note Taking Express. They would send it back to me, fully transcribed. That saved me huge. And then I would even pass that on to other students, and a lot of people did find that helpful as well. So I tried to pay it forward a little bit. Okay, so the final on that class is tough, and that class is significant. Other ways to study for that course: watching YouTube videos. Sarah, Nurse RN, you're gonna hear her voice a lot in your head. Like, she always starts every video with "Let's get started," and so that's still stuck in my head, even though I'm on break right now. So that's 271. Next class is 272. That's applying the nursing process. That's 5 credits. That's 3 credits didactic, 2 credits of clinical, and that is a continuation of 271. You're going to have less pharmacology, but still a lot of pathophysiology. The main concepts in this class are going to be like sensory perception, cataracts, glaucoma, hearing impairments, mobility, fractures, MS, osteoarthritis, Parkinson's, tissue integrity, burns, tissue healing, nursing skills like enemas, Foley catheterization, sterile technique, metabolism, diabetes, obesity, liver disease. That class, the breakdown for exams is going to be 3 exams, 20% each, and then a final exam, which is 20%. Every week, you will have discussion boards and case studies. These discussion boards require you to write about 200 words about a specific topic for that week. There's lots of multiple choice questions. Those are worth 7% through PrepU and EAQ. And then your clinical and simulation reflection is 3%. You will be tested on how to do certain competency skills, such as blood pressure, resting heart rate, Foley catheter, blood pressure, resting heart rate. Yeah, there's probably a couple more that I'm forgetting in there. And your clinicals pass-fail. Definitely, before you get into nursing school, you should be confident on how to do, manual pulse, resting heart rate, radial, carotid. You don't get tested on femoral, but you should still know where it is, and also your pedal pulse on your foot. You should also know where that is also. So that's 272. Again, that was a hard class, but the material is laid out very well, easy to digest, great instructors for those 2 courses. 271, 272, good to go. 273 is the next course. That is Assessment and Health Promotion. This course was a different instructor who I'm not a fan about because she didn't do any lectures herself. It seemed like she just collected lectures from other people, and then she just kind of threw them up on there. And sometimes she just threw in like maybe 10 videos and PowerPoint slides, which was impossible to get through, like literally impossible to get through, and there was no guidance on how to digest all the information. I feel like she inherited that course and she just kind of threw the information out at you, and you just got to figure it out. So that was a weird course. It's broken down by competency skills. You're going to have to do a head-to-toe assessment, postpartum assessment, vital signs, wound care, hygiene, and perennial nutrition. And even as I'm going through the syllabus now, it's not as great as the other courses. Again, there are 3 exams on this course. The final exam is 20%. The HESI assessment exam, the weekly discussion boards. Again, you got to do 200 words every week for a certain topic. Adaptive quizzing, 8%, and then there's a HESI practice test. So other topics in this course, I'm just going through the syllabus now. So mainly assessment of like pretty much every part of the body. That's the big thing on assessment. There's wound care. There is physical assessment. There's acute and chronic pain. That's really, really useful. It's cognition. So again, not your hardest class, but one of the more least organized classes that I've taken. Okay, and the last class we took was 270. And class 270, that is your fundamentals course. So our professor for that was also the program director, and we had a second professor who, I'm pulling up the syllabus now for that course. And this is your basic intro concepts. So you're going to talk about and become knowledgeable upon spirituality, culture, the nursing process. ADPI is big in nursing, legal issues, healthcare systems, quality improvement. The lectures for this class were either comprehensive or non-existent. Sometimes we would have a comprehensive lecture, usually from Professor Ford, and then when we would have a lecture by Rachel West, it would be probably 10 PowerPoint slides, typically no audio voiceover, but she would highlight aspects in the book that we needed to know about. So not the most difficult class, but not as interesting in regards to pathophysiology, but still very essential. So you will really develop more of your nursing mentality through that course, and have a better understanding of culture and sensitivity, bedside manner. So important course, but definitely not as interesting as your previous ones. So those are the courses that you'll take